CDC is expected to announce these new mask guidelines finally, and that will include information for how vaccinated people can resume activity safely in public. A federal health official tells CBS News that in remarks later this afternoon, President Biden will also discuss the new recommendations from the health agency. Meantime, young people continue to get hit by the impact of the UK coronavirus variant that is spreading in Michigan. According to the Michigan Health and Hospital Association, pediatric COVID-19 hospitalization rates increased more than 300% in just over the past 2 months. For more on this, let's bring in Dr. Dyan Hes. She is the founder of Gramercy Pediatrics in New York City. Dr. Hes, always great to see you. So what are you expecting we may hear about these updated mask guidelines?
I think that they're going to loosen them. I think literally they're going to loosen them and let people who are vaccinated and people who feel safe take off their mask. I think that the most vulnerable should not take off their masks if they're not vaccinated, because we know where that leads us. But when you think about doing like a live study, an in vivo study, I think about a state like Florida, where when you go, most people outside are not wearing masks, and we're not seeing massive numbers. Whereas states like California, where there was a lockdown, despite having good weather, people were forced indoors because they didn't go to school and they didn't go to work. And that's where we saw huge spikes in the COVID virus. So I think outdoors, when you think about it, when we're putting people indoors, we're saying they need to have a turnover of air every 4 to 6 out, like a certain amount of turnover of air. I can't remember the exact term. But when you're outdoors, the air is being turned over. So I think that we've seen in day camps that were open last summer that didn't mask, the kids were safe. There weren't huge outbreaks.
So I don't know if people find out that they can actually sort of live their life a little bit differently if they are vaccinated. Do you think that maybe that will encourage some people who are kind of on the fence to get the shot?
I would hope so. I mean, I have to say it's very sad here in New York City. I feel like everybody who can get the vaccine could, and now many of my shifts to vaccinate have been canceled because people aren't signing up anymore. So is that a good thing because most New Yorkers are vaccinated, or is that because there's so much vaccine hesitancy? I feel like the people who really believed in science and trusted the vaccine and want to get back to normal got the vaccine, and now we're like really have to do some great public relations with patients who are vaccine hesitant, because until the majority of adults for sure are vaccinated, we're never going to stop this pandemic, as you see what's going on in Michigan.
Yeah, and I think, Dr. Hes, that people in this country are probably in for a rude awakening as things start to loosen up here, but remain sort of strict everywhere else. Like a lot of people, I'm starting to think about potentially taking a vacation. I haven't had one since December of 2019, and I started looking at countries, even just in the Caribbean, where they have had very low rates of infection, and nobody has died in some of these countries, and yet you've got to do multiple. There are multiple steps to take before you can even travel, including testing, including proof of vaccination, and testing once you're on the island, quarantining once you get onto some of these islands. And so it'll be interesting as people start to complain about sort of the strict measures that the CDC has recommended here, what people are going to expect if they try to leave this country and go somewhere else. So I think that'll be sort of eye-opening for a lot of people.
Definitely. I'm looking now to take my son to Israel, and I think that's an impossibility because I have a passport and he doesn't. It's countries that are low in low in COVID numbers. They don't want especially like an island or a place like Israel where people don't travel so much. They're homebound, like home on that island. And Australia, perfect example. They don't want anyone bringing COVID back after they worked so hard and did a great job of getting rid of it.
Yeah, it's a good point. And so let me ask you about Michigan when it comes to states like Michigan who are experiencing a spike in infections and specifically an increase in pediatric hospitalizations. Are expanding mask requirements to include children as young as two years old?
I think that's what's been so successful in New York. So in New York State, we have to have, if your child goes to school or daycare, they have to be masked over age 2 if they can tolerate it at age 3. And it's amazing. All of my patients are amazing mask wearers. Their parents are pulling the mask down every second, and the kids keep the mask on. And when I have to check their mouth, and I've said this before on your show, I ask them, can I take down your mask to look in your throat? They're very nervous because they've been taught that that mask has to stay on. They're little. This is what they know. They started school during a pandemic, or they've been going to school during a pandemic. Just like, you know, you follow rules that your teacher says. Kids are really, for the most part, good rule followers. And I can tell you that in other states, the mask mandate is over age 7 and over age 8, and that is not. That's really, it's just an arbitrary number that they pick, because the kids who get COVID are not the ones who are super sick, but the kids who get COVID bring it back to their homes, and then their families get sick if they're unvaccinated. So I think the bottom line here is get the vaccine. If you're over age 16, get your child vaccinated, get your grandparents vaccinated. We want to go back to normal. We want an open economy. We have to do this. Look at Israel. They are open. Nobody's wearing masks. They did it. They are vaccinated.
Yeah, I know. You just reminded me of my own daughter. She'll wear her mask. You know, she's older, but she'll wear her mask all day long at school, come home, and it'll be like 2-3 hours she's at home and she's still wearing the mask. And I got to remind her, right? It's okay. Your parents are not infected. You can pull the mask down, but she is really, really good. But you know what? So I want to ask you about this. So part of the reason that things are very concerning in Michigan is because of this UK variant. And we're also kind of seeing some reports that indicate that as kids participate more in group sports that may have been canceled before, that's another area where we're seeing kind of spikes in infections. So, you know, what do parents need to know about these new variants and about, you know, allowing their kids to do kid stuff? The weather's warmer now, and the kids want to get out and they want to go to summer camp and that kind of stuff.
You know, you have to remember that the mortality rate from COVID for children is I think it's 0.21%. Okay, so it's I think it's 0.021%. So it is very, very low. And you think about, we let our kids go to sports during flu season, and flu season has a much higher mortality and morbidity rate for children. So I think you have to take all the factors in account. I think not having your children play sports, not having your children in school, having kids depressed, not socialized. You know, a new study said that children are about 9 months behind in school since they've been through this pandemic, and they're not going to get time to make that up. They don't get to repeat 5th grade. They have to go to 6th grade. We need our kids socialized. We know that the kids are not suffering terribly from COVID. If they have it, most likely it's like a cold. I can tell you in my patients, it's usually like a cold for a day at most, or they just tested positive and didn't know they had it. We know the risk factors. If your child is obese, that is definitely a risk factor to have a worse case of COVID. So you might want your child wearing a mask when they play sports. But it's still better to play sports and be active and not sitting home and eating chips, because your risk of having COVID is much worse if you're overweight. We're seeing kids gain 20, 30 pounds this year because they've been sitting home with no sports and no activities. So you have to, it's called risk-benefit ratio.
That makes a lot of sense. Dr. Dyan Hes, thank you.
All right, take care.